Hey, coming up here at the first of the year, there's going to be some changes to health care laws as the President Obama's health care initiative kind of gets phased in over time and other laws also kick in. Well, what does that mean for you? Are your rates going up? Is your coverage going to change? Well, our insurance expert is here to help you this morning, try to sort through some of that. Craig Gussin joins us once again. This is just, I don't know how you even begin to keep all this stuff straight. I mean, how many pages was the President's health care bill?
2,700 and ended up being 27,000.
Right.
So it's unbelievable how it is, and it's everything's slowly going into place until 2014, January 1st, and then everything will be there. But right now, all we can look at is what's happening effective January 1st and all of 2012, and that's the big issue right now.
Well, we'll take the politics out of it then for the
Right.
time being and set that aside, and folks can sort that out at a different time. But in terms of what is taking effect the first of the year, talk to me first about the pregnancy disability leave, because that's a big one.
It is if you're an employer. It's very big, because what happens is, in today's world, if you are pregnant and go on maternity leave, the employer normally will just put you on COBRA. You'll be at home or in the hospital having your baby. You're going to pay for your health insurance until you come back to work. Effective January 1st, if you have a company with 5 or more employees, you have to continue to pay your portion as the employer of the health insurance premiums that you were paying, and the employee pays their part. They stay on the group plan. The issue that I have with that, and the problem I've always seen, is that the employer, normally what happens is the employer gets the bill from the insurance company, they pay the bill, send money into the insurance company, and then get reimbursed from the employees, usually through the paycheck.
Right.
But if you're on maternity leave, you have no paycheck. So how is the employer going to be reimbursed? Well, the reality is, in theory, the employee is going to write a check and pay the employer. But my big question and my concern that I've seen happen a lot is the employee does not do that. And then the question that I have, and nobody can answer it yet, can the employer then cancel the plan on the person?
For non-payment.
For non-payment.
Okay.
And we don't know what the answer is. I've seen nothing in anything I've read that says you can do it. Now, it only goes on for 4 months. But still, requiring the employer to pay 4 months premium payments, I've seen that happen to clients of mine, and the employee never came back, even though up to the day they left, they kept saying, oh, yeah, I'm coming back after I have my baby. And then the employer is stuck with paying for 4 months and never getting
So there's a couple of issues there. It's an increased cost to the employer, and then
Right.
there's some question about how the employee is going to even pay for that when they're off on maternity leave.
And not receiving a paycheck.
And so that has not been resolved, so
No.
we'll keep an eye on that. Okay, this new health insurance fee for research. This is one of those things that's kind of hidden in there, and it's certainly not discussed by politicians and so forth, but it's in the bill.
It's in the bill. I actually found out about it last night when I was getting together, getting ready to meet with you. Basically what they're saying is that they're going to charge the insurance companies a research fee, and what it's going to do is they're going to go out and they're going to look and see, were old generic drugs better than new generic drugs?
So the government is now going to be
Right.
in the research business and deciding which drugs
Right.
are better, not the medical profession, or the insurance company, but the government.
The government. And we know from past history, anytime you add a fee on to an insurance company or any company, they're going to turn around and give it back to the consumer in an increase in cost. So if you take the Disability Leave Act and you're saying, what's that going to do? You take this one. You take the doc fix, which is the one that's been going on for a while, where they just gave another 2-month leave to the doctors who accept Medicare.
But this is where they keep talking about cutting back the
Yes.
amount of money that doctors
Yes.
are going to receive for seeing Medicare patients.
Right.
Now they put that on hold again for another 2 months.
And that's a 27.4% decrease in pay that the doctor's going to get. And based on past history, every time Medicare or any organization cut back what they're going to pay the doctors, what they ended up doing is turning around and increasing what they're going to charge the insurance companies for their services. So the insurance company ends up paying for it. The insurance company then ends up charging more money to the consumer to help offset their costs.
So just with those 3 things alone, you see those 3 things would contribute to an increase in
Yes.
consumers' health care
Right.
rates and what you pay to your insurance company.
And the major one we haven't even talked about, and that is the one that we first talked about, and that is as of July 1st, 2012, every health insurance plan in California, it's a California law, has to have maternity coverage. Now, group insurance usually has maternity coverage right now. There's very few plans that don't have it. Individual plans, 5 years ago, 70% of them had it. Today, there's probably 10%. And if you take away Kaiser, it's probably 3 plans out there. So when you look at a plan that are similar, one has maternity coverage, one doesn't, the difference in cost is somewhere between at least $100 to $250 a month.
$100 to $250 a month?
Month difference in cost.
So if California now is forcing companies to carry maternity insurance, you could expect that your rate could, if you're with one of those plans that doesn't currently offer it, and you might have chosen that in order to save the money, could go up $150 a month.
Could be. What I'm hearing is, I've heard some people say rates are going to go up across the board about $10 a month because everybody's going to pay for it. I don't know about that. Other people have said $50 plus. I'm leaning towards the $50 plus, but I don't know. I'm still trying to get the ideas of where it's going to come. But that's a big concern because in today's world, I'll meet a woman and she'll say to me, you know, I don't plan on having kids right now, so I don't need maternity coverage. Let me go with the lower cost plan. Now, as a guy, you don't need maternity coverage, but you're going to be paying for maternity coverage as of July of next year. If you have an individual health insurance plan, you don't have it through your job, and you just go out and get it through me or any other health insurance broker, then you're going to pick a plan without maternity coverage. And as of July 1st, you have to have maternity coverage on your plan. And I just think that part's unfair.
So I'm a guy.
Right.
I don't need it, not going to need it, never going to need it, and yet I'm still going to have to pay for it. So they're trying to spread the cost for these added benefits over everybody's premiums.
And the concept is, I understand the concept, and I understand why we should do it. But when you look at this and you say you have a woman who maybe can't have kids, maybe past childbearing age and had that taken care of, and not going to have kids, they're paying something that, you know, they really don't need, and I just think that part's unfair. And I just think when, you know, with everything else going on, and now we're going to have another rate increase, and you add these 4 laws together, I don't know what rates are going to be by the end of next year. But I do know that California has the 8th lowest rates in the country. And if you look at California as a own country, we're the 8th largest country in the world. So we have done a great job in California to keep rates low. When you look at health care reform, you look at these laws, our rates have nowhere to go but up. And when you look at examples of New York, which guarantees anybody in the state health insurance anytime you want it, I have a client, she's 59, she has $1,000 deductible, and she pays $1,859 a month for her coverage.
$1,859 a month?
Yes, the same person here would pay about $500 or $600 a month. And it's just, and the reason is because there you can buy it whenever you want, you can cancel it whenever you want, and come back on it whenever you want. So with you, when you hurt your leg, you could have bought the coverage that day, kept it till you're done, and then dropped it. So I don't want to get to where New York, New Jersey, and Massachusetts is.
Right.
I want to stay where California has, you know, some of the lowest rates in the country, and have been very successful at doing it because we have 7 insurance companies in California that you can do business with, and it's competition.
Right. Craig Gussin, it's always great to see you here.
Good to see you.
We're going to have you back. I know you're going to head to Washington at the end of next month. You're going to be sorting this out with a lot of politicians there and the folks that are involved in writing health care legislation and seeing what you can do to keep us here in California at least one of the cheaper places in the country, even though it's still very expensive. Great to see you. Thanks for coming in and breaking it down for us.
Thank you.
All right.